The biggest limitation of using cell-free DNA for cancer detection is that not all cancers shed DNA. Shed of DNA seems to be more related to the aggressiveness of the cancer. Interestingly, when we looked in this CCGA2 report at ESMO comparing, for example, different types of lung cancer, squamous lung cancers are easier to detect as opposed to adenocarcinoma, which is harder to detect, presumably because there is more shed of DNA from squamous as opposed to adenocarcinoma. HR-positive breast cancers, hormone receptor-positive breast cancers, are harder to detect. Hormone receptor-negative breast cancers, we have higher detection rates, again, presumably related to different rates of DNA shed. What we described last year at ASCO is that the cancers we are finding end up being cancers that are associated with mortality. And that's across stages. So even within stage, having a cancer found with this assay predicts a higher risk, more morbid cancer, as opposed to low risk, overdiagnosis, not important cancers we're missing. And maybe that's a strength of an assay like this, right? Because the big concern for screening tests is you're going to find a bunch of unimportant cancers and you're going to turn everyone into cancer patients. And people are worried that this blood test will find thyroid nodules and to find unimportant cancers. That's not what we're doing. We are finding real cancers that have a real risk to the patient's mortality. And in a day where our treatments are getting better, this may be just the way to find the cancers that need treatment and get them to treatment. So I think that limited shed of DNA, yes, is a potential limitation of cell-free DNA detection tests, but also maybe an opportunity to make sure we find the right kind of cancers that need to be found.